So you're the creator of the joint and ligament cream from RegenX. So why do you think this is the best cream for the regeneration of joint and ligament?
So I've been doing chiropractic for 20 years.
Yeah.
I've seen over 100,000 patient visits. And what I saw as a pattern, and anybody I'm in my 50s, we never saw the sports injuries when I was playing high school football, basketball, track. We didn't see the ACL tears, the meniscus tears. We didn't see the shoulder issues we have today in these young kids, playing high school sports. So I saw two things happening. I saw people my age having their joints replaced for no particular reason except that they were wore out. And then the young kids were tearing things in half at 16, 17. And so the difference was that I was trying to go out and do a jog or lift a few weights or just be active, and I'm tearing stuff and losing joints. And the young kids are just trying to be powerful and active, and they were tearing their joints right in half. And the statement I got from the orthopedic surgeons, well, these kids they're just working so hard today. They're just pushing too much weight. They're just pushing these kids too hard. You're a trainer. We can both agree that somebody who's trained and fit should have less chance of injury than somebody who's untrained and unfit. Yes?
True.
So, but it seemed like people doing CrossFit, in their 40s or younger were hurting themselves quite often in these powerful movements, and the young kids in the powerful movements. But I also saw people my age having knees and hips replaced, which I never saw growing up, never saw this. I was trying to figure out the pattern. So as I studied glyphosate and I would muscle test, I kept seeing that the muscles were turned off. So when the muscles are turned off, and we'll go to the joints here, 90% of your joint stability comes from the muscles crossing the joint, okay? So we see a lot of injuries in the knees, Achilles tendons, hips. So if I can't hold that knee perfectly as a hinge joint or as a ball and socket, and I'll just show this to you. So we see a lot in not so much in young kids, but people over 30. If the muscles aren't holding, the tendons and muscles aren't working perfectly, the hip will shift to the outside of the joint with gravity because the muscles aren't holding it perfectly at that 45-degree angle. If my knee is not working perfectly, the hinge joint will load on one edge. So if I micro tear a tendon or a ligament around that joint, primarily tendons, now I have an imbalance in the joint, or I have an imbalance in the hip. Now my hip's sitting in the wrong position. It's loading maybe 10% of the joint surface versus the whole surface.
Yep.
So I still want to move. And like I told you earlier, Nicholas, you can drive a car misaligned.
Yep.
Car's pulling to the right, you just hold the wheel to the left. You can drive the body misaligned with a muscle turned off or hip muscle turned off, a hamstring turned off. It takes more energy, it takes more effort. The misalignment eventually wears the cartilage off the surface, okay? And there is no nerve supply in the cartilage. So what we're seeing is normal movement creating absolute failures by 45 or 50 in the joint surface. But by having a powerful movement like a jump and land, sprint, stop, start, redirection, soccer, hockey, basketball, football, not so much in swimming, okay? That's where we're having these tears, because if I'm standing here, it's my body weight through my joints. When I start to walk, the weight doubles through my joints. If I start to run, it's 4 times my body weight through my joints. If I jump up and land in any sport, accelerate, decelerate like a jump or a land, it's 10 times my body weight through my sport. So if I'm a 200-pound athlete, I'm putting 2,000 pounds of force through my knee. If my muscles around my joint aren't fully contracting and taking most of that load, then it all drives down to the small ligaments inside the joint. And there goes my ACL, there goes my Achilles. So I have to have good attachments. So we found after testing, 2 things are happening. One, we kept picking up a toxin in the joint. We kept picking up a deficiency. It seemed like the toxin was herbicide-based. That's glyphosate. What's it do? It steals copper 1 million times faster than any other mineral that's used to hold the joint together. You want to cross-link your collagen fibers, and I explained on the board how the copper cross-links. We saw a huge deficiency in copper because glyphosate would work its way into the joint, into the soft tissue, the white tissue, the collagen, and it would grab a hold of the copper and boron and manganese, and now you have no cross-linking. And the other part of it was we found with the joints is that the mitochondria we talked about earlier use in the electron transport chain use copper to make energy. So if I take the energy out of the electron transport chain, the copper out, I cannot make enough energy to repair between practices. So what happens to me? I go to practice, I jump, I lift weights, I sprint, I move, and I create micro tears. And as you know, as a trainer, you're supposed to break down and then repair, thicker, stronger, more powerful. But if I can't repair because I've lost the copper in my energy pathway, I've lost the cross-linking ability, I'm making brittle collagen, and I can't repair the collagen I have. So guess what happens? I wear, micro tear, don't repair, go out and wear myself out, micro tear, don't repair, micro tear, don't repair, and I have a catastrophic failure. And now I'm in front of a surgeon, and he says, you're just too powerful. You jump too high, you move too fast, you took too many steps. Mr. Jones, at 53, you should have your hips replaced, and at 60, we'll do your knees. Complete, absolute garbage.
Bullshit.
Bullshit, yeah. So what we did is we went through and we said, let's create a cream that's transdermal, that puts in exactly what we're missing. And as I showed you, this stuff doesn't take months to work. It works literally in a minute or two because we have a lot of products in here that actually drive the minerals right into the tissue. There's three types of copper in here: boron, manganese, magnesium, and all the amino acids that go ahead and rebuild. So we can drive it in, and literally in a matter of minutes, you start to stabilize that joint. After about 4 months of using this, we find on average, if a person's fairly healthy, after 4 months, we have saturated the minerals back into the tissue. So the electron transport chain works, you're making good energy there, you're cross-linking, and you have the strength back to the collagen. So in my clinic, this is a really big seller because there is the person out there that can escape glyphosate completely. There's a person out there that's not deficient in copper. And I'm talking about a localized deficiency because the glyphosate goes into the collagen and sits in there, steals the mineral out. Then I can't make energy repair and I can't cross-link to make strong, tensilely strong, torsionally strong collagen. I have brittle collagen. So we've resolved most of these problems in our young athletes in our clinic, and it gives pretty good pain relief for a lot of people because if you can turn the muscles back on and that knee is moving properly in that single vector, that single plane, you don't wear out anymore.
So we are in business with this cream?
Yes. Yeah, so it's one of our best sellers, and I think that this is something that it'll be called Joint-Regen, and as the product comes out in February, it'll be in tubes. Right now it's just a joint ligament, but we're really trying to regenerate the joint naturally.
Excellent. Thanks a lot.
You bet.